What should you do if you, as you are driving or going by, you see a patient is having a road traffic accident and lying on the road. He's fallen off the bike, had an accident and lying on the road. There are some very important things that you should remember that you should do as a passerby or a bystander, and I hope this video will really help you in saving a life. The first thing that you do is, when you see a patient on the road, first move this patient to an area of safety. Don't try anything right in the middle of the road, or the next vehicle will come and hit you also. So first, always make sure that your patient or whoever is the accident victim is moved to a safe zone. Safe zone means either the footpath, the side of the road, any muddy place, keep them there, then only start helping the patient. Now how do you move a patient? Always remember, any accident victim, the two most important areas are the head and the neck. Okay? So whenever you are trying to lift a patient, there is a technique in which you do it, that is called, put your arm under both the shoulders, okay, and let the patient's head rest on your shoulder. Let one more person lift the hip, and then you gently lift the patient and move them to the side of the bed, okay, or the side of the road. Be very careful that the head and the neck of the patient never moves, because if they have a fracture here, then you will end up paralyzing the patient. Okay. This is different in a hospital, but at the roadside it is called scoop. You put the patient's head here between this and lift them literally like a scoop. Somebody has to carry the pelvis and very gently move the patient to safety. Okay. The next thing what you have to do is, if look at the patient, is he conscious, unconscious or breathing? If you find that the patient has no pulse and unconscious, then we do something called start CPR. If the patient is conscious, having an open, maybe a cut or a fracture, what do? Immediately take a clean cloth, like for example he has a injury on his leg, an open injury, take any clean cloth, not a dirty cloth, take a clean cloth and press the bleeding wound. Okay. If it is a fracture, then use anything, use a wooden stick, use a rod, anything, and just put it under the fractured segment and just tie it up. Use any cloth and tie it up. This way you will prevent massive bleeding or the limb getting further damaged. Okay. So open wound, apply pressure with a clean cloth. If it is fractured, take any piece of wood or anything that you can find and fix the fracture. Make sure the whole time the patient is breathing, lying down. Never give water to an accident patient. Don't throw water, don't make him drink water. Okay. While you are calling for ambulance, make sure that you wait at that site till the ambulance comes. Why? Because your phone may be the only way the ambulance can reach the patient. Okay. Another important thing is, if it is a road traffic accident patient who is fallen with his helmet inside, okay. So he is basically fallen like this. So what you have to do, you cannot just lift off the helmet. First thing you have to do is lift the visor if it is this kind of a helmet, allow the patient to breathe. Okay. Now the way to remove it is, first remove the buckle, okay, release this, make sure that he has enough space to breathe, hold his face like this, make one person hold the face, and with gentle movements which are up and down like this, gently remove. Don't shake the patient's head side by side, gently move it up and down, remove the helmet and gently put his head back so he can breathe. So these are basic steps for any accident victim. Again, when you are putting into the ambulance, use the same steps. Protect the head, neck from any movement, head, neck and spine, then only move. Okay. So I hope this video helps you in resuscitating an accident victim. Thank you.